Hi, it's David Liew here at EULAR 2022 for Room Now, back in the saddle in Copenhagen. And what I'd like to just briefly mention is some of this EULAR is a global meeting. And I really just want to talk a little bit about how global implications might have implications for the kind of evidence that we consume. So the study I want to talk about is OP0035. And what it is, it's a study looking at data across many different countries, all collated about the time of onset of rheumatoid arthritis. It's part of a METEOR study. It's spun off from the METEOR study. Lots of different people that you'd know of that involved in this. But what they were looking at are how the age of onset of RA varies around the world. There's been some speculation in the past that the closer you get to the equator, and I guess that might well be what you call the global south, that those countries tend to have earlier onset of rheumatoid arthritis compared to those further away from the equator. And so what this study looked at was that, but then also looked to try and see what might drive that if that was the case. Indeed, the METEOR study data did in fact show this was the case. But what it showed was that in fact, most of those things related to country-specific factors rather than disease-specific factors. Now, I could go through the detail and it's quite fascinating the way that it was broken down. But I think the key bit here is the fact that we always presume that the rheumatoid arthritis that I see in clinic in Australia, or that you might see in clinic if you live in a temperate country, is the same rheumatoid arthritis that is happening in other parts of the world which are closer to the equator. But in reality, rheumatoid arthritis is a complex disease. It's a complex disease that is reliant on healthcare systems, reliant on socioeconomic factors. And those are the kind of things that make up what the disease actually is. Now, there's an increasing trend because of a variety of different things, partially because we're treating in the temperate world, in the temperate climate world, we tend to have more money and we tend to be treating rheumatoid arthritis better because we have more money. So we tend to be now trying to recruit patients from places where that isn't necessarily the case. And the question, of course, is how much do those patients actually resemble the patients that are in our clinic? Not just biologically, but in terms of the socioeconomic factors, their motivations. We've talked a bit about this on Room Now before, but I think it bears remembering that maybe rheumatoid arthritis may well be different around the world. Of course, there's a social equity component to all of this, and it probably is worthwhile thinking about the global burden of rheumatoid arthritis. But in terms of what reflects into our rich world clinics, certainly it's a fact that maybe not all rheumatoid arthritis around the world is exactly the same. For more data like that and plenty more from a very interesting in-person as well as virtual conference, head on down to roomnow.com for all the EULAR 2022 updates.